Welcome to Health Policy, Organization, and Finance. This is your Week 2 video. Last week we discussed really the biggest issue in healthcare right now, which is the rising costs of healthcare. You read quite a few articles and your textbook about the cost of healthcare, and in your discussion post and in your response post, you used the analyzation tool of cost to look at health policy. You really should have thought about the different analytical tools so far: cost, quality, and access. This week we're going to continue our discussion of those analyzation tools, and we're also going to talk about healthcare finance. Just a note, some of you may have already thought about this, but if you haven't, I'm not going to hide the ball. Cost, quality, and access in terms of policy are all interconnected. For instance, if you increase the quality of healthcare, that's likely to increase costs, just like decreasing access might lower costs. So I'm going to give you other tools for analyzing healthcare throughout the semester. However, these three initial tools, just keep in mind that they're really interconnected. So again, this week we will continue to talk about cost and specifically how healthcare is paid for. I want you to also think about quality this week. So even though we continue our discussion of costs, you're going to have readings about healthcare financing, there's a lot of underlying quality issues in there too, so make sure to look for those. One of the things you're going to hear over and over again is that nationally, and sometimes locally, healthcare policy is moving from a quantity of model care to a quality of care model. And that's really tied into some of the topics that we discussed this week. But you'll see a lot of terms thrown at you. The fee-for-service model is really the model that healthcare has been using for the last couple decades, maybe even a century, where clinicians, hospitals, doctors, multiple providers are paid or seek reimbursement based on what was done. You'll be introduced to a couple of other models for healthcare financing. Two of those I think that are really important are bundled payment systems and capitation. So you'll see a bunch of different types of healthcare financing models, but capitation and bundled payments as well as fee-for-service are the ones I think you should focus on. So healthcare quality. What is healthcare quality? I will add a couple articles that discuss what exactly we think healthcare quality is. Usually what healthcare quality does is tries to improve health outcomes, increase collaboration between partners, enhance patient communication, and eliminate waste. However, a bunch of other things can go into healthcare quality as well. So what does it look like in practice? As I said, fee-for-service model is the main model, which incentivizes more services. But a quality model using quality of care as the benchmark tends to look at paying providers for what works rather than what gets done. So let's review our tools, and I'll give you some examples since quality in healthcare can be a little confusing. You were given the initial tools of cost, quality, and access. Last week I wanted you to think about cost. When you look at a policy last week, I wanted you to think, okay, what's the cost of this policy? This week, I want you to think about quality. And as simple as I can put it, when you look at a policy this week, I want you to think, does this policy create quality care? Naturally, you're going to say, okay, I'm not sure exactly what quality care is. So I'll give you a couple of examples. Susan Smith, you remember her from week 1, is the director of the Center for Disease Control. She had submitted a bill to the legislature to require a vaccination of all infants born in the state. Susan comes back to you because she knows you're an expert health policy student and asked you if you think this is good policy. Well, we thought about if it's good policy based on cost last week, and this week we're going to think about it using quality. So what you would say to Susan is, well, if this is good policy, it would promote quality care, right? Well, what does that mean? Well, is this vaccination going to improve health outcomes? Well, it should, right? Vaccinations are very effective, and making sure all infants in the state are vaccinated could improve health outcomes. You could say to Susan also, is this going to increase collaboration? Well, maybe. We don't know. How is the vaccination policy going to increase collaboration? Will it enhance patient communication? Probably. This will incentivize a lot of doctors and nurses to talk to young parents and new parents about vaccinations. Does that eliminate waste? Well, maybe. You'd have to think about what exactly is wasted, right? Let's look at another example. Sam Smith, the medical director of the health clinic, sends out a memo to the physicians of the clinic requesting them to discuss drug use with middle school students at their annual appointment. Sam asks you, as a health policy student, if this is good policy. Well, last week you helped Sam think about whether or not this was good policy based on cost. But this week you would say, well, does this really promote quality care? Well, does it improve health outcomes? Probably. As we said last week, we're not sure how big the population would be, but it probably should improve health outcomes. Does it increase collaboration? Well, we're not sure how the clinic works, so we don't really know. Does it enhance patient communication? Yeah, it probably does. It has physicians talking to more middle school students at their annual appointment about another factor of their health. And does it eliminate waste? Maybe. It would matter what exactly would be wasted beforehand. So there's two examples. I hope that clarified a little bit what we're doing this week. Keep in mind, U.S. health policy is moving from a quantity model of care to a quality model of care. This means we're trying to move away from a fee-for-service system into another system. Maybe that's bundled payments, maybe that's capitation, maybe it's something else. Is this good policy? Well, we'll have to talk about it. There will be a discussion post this week regarding quality care, so you'll have a chance to really digest all this information. So that's it for week 2. As always, let me know if you have any questions, comments, or concerns, and dive right in.